We only have 4 of us.
Yeah, well, we're not voting on anything, so we don't need a quorum to
Right.
get started.
Okay.
Yes, and I'm frustrated that we only have 4, but we've got to move on. Chris, can you hear me? All right, man.
Yep, here I am. Sorry about that.
No, it's fine. It's just because I know you're one of the individuals that wanted to talk, to ask these questions. So we have these individuals at everyone's disposal. Madam Vice Chair, before we move forward, and again, we're not solving this bill today, ladies and gentlemen, but I did want to talk. I spoke with Madam Vice Chair earlier today. I am still in a very difficult spot. I'm not willing to totally discard the healthcare profession as far as them not reporting to work. I just can't, there are too many doctors and nurses died, doing our bidding, trying to save us. There's got to be a better solution. And speaking with Madam Vice Chair, I believe we're going to look in some other directions for some already existing language and already, from other areas. Is that correct, Madam Vice Chair?
That is correct. Yes.
And so there are other agencies that may already be controlling this. And much like what we're doing today, we may not need to recreate this wheel, okay? What we're trying to find out today, because we want to have something in place. We want this to be more than a feel-good bill, but I'm not trying to, again, do something, cut somebody out of some right that they need, especially if there's already something in place that addresses that issue.
Right.
Gentlemen, I don't know, I guess, are you guys here? Do you guys want to do a brief introduction? Or do you want me to just go ahead and start winging questions at you guys?
Well, I'll go first. I'm Matt Helminiak. I'm Commissioner of Labor and Industry. Moshe is one of our units. Mike Straka is our Assistant Commissioner. His experience is pretty extensive. We stole him from another place in 2019. He's worked for federal OSHA and in the private sector, so has pretty extensive experience and can talk about all the issues that you can ask us with today.
All right, gentlemen. Thank you guys for attending. Chris has his hand up as expected. Please.
Thank you, Mr. Chairman. I think where we ended the conversation yesterday was, how long does it take Moshe to go through a investigation? First and foremost, I think that this particular bill grants the commissioner, broad sweeping authority, but I was trying to narrow down, how quickly the adjudication comes, because where we were at yesterday, you had this question about if you have an unsafe work environment, can somebody just up and leave? Clearly the question is going to be how long can they leave? And the answer theoretically would be, well, they'll leave until Moshe would conduct an investigation. The commissioner makes some determination. I think I already know the answer, but I'd be curious on a normal business day when you get a complaint, just walk me through the time frame. Not during a pandemic, because that's and this bill applies, but just normal business.
Well, part of that that's kind of like a 3-part question, and I'll let Mike handle the part about how long a Moshe investigation takes. The whistleblower statute, the right to refuse, all that stuff's already covered in Moshe law. So the parts of this bill that deal with right to refuse and anti-retaliation is already covered. And in fact, the language that you have would conflict. You can't exempt individuals from that. So that whole part is duplicative of current law.
Do you happen to know the section of the?
I was going to say, we're going to need to refer to specific sections, and we're still drafting something. So, and if you don't have it right now, please, if you can email us these specific sections, that would be amazing, because we're going to still refer to these sections. And I do appreciate your input on that, because that makes our life a whole lot easier, as I'm sure it does yours.
Well, and so does the entire end part that deals with the emerging temporary standard. Federal OSHA hasn't officially announced it, but they've made it known that one's coming in the next couple of weeks, and we'll be adopting that as required by law. So that whole section is duplicative too. But I'll let Mike chime in with the explanation of what a Moshe investigation in the process.
Sure. Hello, everyone. Nice to meet you all via Zoom. To answer your question about how long an investigation takes, one thing I want to preface is that despite what some people might have preconceived notions of what OSHA and MOSH do. It's actually a very prescribed process, and it's actually designed to be, MOSH and OSHA is designed to be an unbiased third party. So when you talk about the adjudication process, it's not necessarily a simple thing. The response to an unsafe working condition, the response to a complaint, that is fairly quick. We have our own targets in order to be at least as effective as federal OSHA to be able to respond to a fatality within a day of when we hear about it, serious accidents, catastrophes, that sort of thing. The initiation of the inspection is very quick. However, the process can take up to 6 months before we have 6 months. That's our statute of limitations, is 6 months to issue a citation. So and finish the investigation. So once that happens, it's not technically over. The employer does have the right to contest the violation, and that gets adjudicated in a hearing. Now, the state, being a state plan state, that process is a lot quicker than federal OSHA. Federal OSHA could take years before they got through that. It's relatively speedy, but you're still talking months before it gets heard in front of an administrative law judge. And then after that, depending on how the results are, it could then be appealed to the commissioner himself. So it is a prolonged process. So you have 6 months to complete an inspection, and you have and then it can be adjudicated probably a number of months after that before you get a final rule on it. In regards to you talked about a workplace concern. We have a non-formal complaint investigation process, which means we reach out to the company immediately, and then they have 15 days to provide a response that either the complaint was unfounded or they've taken steps to address the complaint. That is a fairly quicker process in regards to finding out whether or not a hazard is legitimate, but that's typically the timeline with that. And with that, we share the information with the complainant. The complainant has the ability to refute that. If they refute it and we find that the refuting it is valid, we would then roll it to inspection, which again starts the 6 month process.
Mr. Chairman, that was my only question, and I thank you for.
Thank you. And thank you, Chris. And before I move, I just have to ask, could you couch this? If there's a hazmat spill at my job, I work in a hospital, working I don't know, tell me what the time and is there a different measure of alacrity as far as, speed of investigation? How would that be treated any different as far as your investigation goes? If I'm saying there's a hazmat spill.
In a hazmat spill, an active hazmat situation, we would deploy people immediately to initiate an inspection, but we still have that prolonged process of within 6 months to complete the inspection. But we would initiate the inspection immediately.
Because to me, that's what I can relate to this most as like a hazardous material spill, something, an emergent issue that's not something you guys can slow walk. And the reason I would ask, and so does that include hospitals or does somebody else? And I know you guys are the big umbrella, but is there a smaller umbrella that would handle hazardous and issues when it comes to hospitals?
So hospitals are there is an element. I'm not an expert on hospitals, but the JCO. I never understood what JCO meant, but that's a board that evaluates the effectiveness of hospitals. That's another organization that can rule on, and every time I've ever been involved as a compliance officer or as the area director dealing with a hospital, that was always the response was, oh yeah, we comply with you guys because JCO's way harder to deal with. That's my only.
Okay, and so that's probably because we're trying to figure out, but beyond that, it sounds like the way the process is already in place, we just will be replicating.
Yeah,
is that nobody can be so let me step back before I step on my own toes here. So how does that work I'm at a facility, there's a hazardous material spill, can I just leave? According to OSHA, we're trying again for people that are at these facilities, they notice that there is an issue. We want them to complain within 24 hours, sure. But they want to have the right to leave or not show up. Are those things currently covered under MOSH?
I would defer. I'll defer to the commissioner, but my only part to say that is that no, typically OSHA and MOSH do not delve in the refusal to work, only in the standpoint of we have discrimination laws that protect. If you feel uncomfortable with a site and you refuse to do work, you can't. If you make that concern aware, the employer can't punish you for refusing to do that because of a safety and health issue.
So you handle the retaliation part.
Yes.
every from a grocery store,
Yes.
liquor store to okay.
Yes.
So that's covered. So as far as the evacuation / not coming into work part, this might be the commissioner's line of thinking here. How does that work? If again, there's a hazardous spill at my job site, I know it. I don't want to go in. By
If it's
current law, do I have a
unsafe,
right?
unsafe.
Right. I'm just using this as an example. Do I have a right to say no under current law? Is the commissioner frozen or is he thinking?
No,
Okay.
I believe you do. I don't think there's a responsibility. There might be an ethical responsibility, like if you're in a hospital where you can't abandon a patient, but nobody's a slave. You can refuse to go to work any day you want.
And because of what you already have in line, they can't be punished for it. That's where we're trying to go.
Right.
We still have to deal with the hospital and the JCO issue.
Right. And we've got active whistleblower investigations that we've been working on for COVID complaints. And we've got one you probably read about in the news for Maryland Legal Aid that is we're actually
yeah.
going forward with it. You'll probably be hearing
Good.
about it.
Good.
You should. That was unbelievable.
Yeah. Yeah. So
We
thank you guys for
found
that.
merit in there moving through the adjudication
Awesome.
process. with that.
I'm delighted to hear that.
And Seth, I know Chris, sorry guys. You have another question?
Well, no, I was just going to ask Mr. Straka, so if I'm in the construction industry and I've got scaffolding up and my worker says this, if I'm coming off the scaffolding, there's nothing in law that would tell me, okay, force the employee to go get up on that scaffold and keep working. The worker has the right to not work in a knowingly unsafe situation. The scaffolding, it's clear if something's not right. It's not right.
Without giving specifics, we had a very similar situation out in Western Maryland where a person was asked to go up on a scaffold to work on a inside of a house that the roof is like this, but they didn't have the right scaffold, and they said, "I don't feel comfortable doing that." And they said, "All right, well, you're fired."
You delegate
called us-
Turner, you need to
Turner,
mute yourself.
Could you mute? Thank you.
Sorry.
Go ahead. Yeah, we can hear you. We just
Okay.
go ahead.
Sorry. We had an exact case like that where they refused to work. They threw them off the job site. A day later, they called us, made us aware of the retribution and the adverse action. We initiated a discrimination investigation, and because it identified a concerning safety and health matter, we sent compliance officers and opened an inspection on that the next day.
Mr. Chairman, that's why us employers don't mess with MOSH.
And just for
It's a strong
clarification,
entity.
the term whistleblower and discrimination are used kind of interchangeably, but those are both the protections for anti-retaliation.
Okay. And
There are 23 statutes of whistleblower laws on the federal level. We are concerned with one statute, so that's why we'll say discrimination as opposed to whistleblower.
And so, and lastly, when we have an issue where we have somebody, they work they drive a bus, they work at a grocery store or a hospital, and they say that there is an unsafe work environment. This comes back to the timing, but how do we assuage their fears? Because at some point, the employer is going to want them to come back to work. And I would take there's an inspection or something done through the investigation.
Yes. So what you're describing is a very key element. What I would tell you is probably one of the biggest parts of motion, the OSHA world, is explaining concern, either explaining away or validating the concern with a complainant. A lot of what my staff do and myself do, because randomly people call my number directly and I get very excited and get to talk about it. We explain, someone explains a concern. All right, this is really bothering me, a scaffold. Well, so what happens is we ask questions. What about the scaffold? Well, it just doesn't feel right. Well, why doesn't it feel right? And we try to beast down to what we're doing is trying to substantiate what the potential violation of safety and health law is. But we're also answering questions on, are they, is this truly a hazard? I have in my experience, we've had somebody call from a department store. They're getting headaches and they felt that it was their carbon monoxide poisoning. And why would you think that? Well, there's a parking garage on the other side of the wall. Well, are there cars running on the other side of the wall? No, but I know there's cars there. So explaining the finer points of how once you shut your car off, the carbon monoxide isn't a ready source, it's not as much of an issue. 9 times out of 10, that sharing of information improves matters. And sometimes they want us to still look into it, and we do. Other times they say, okay, you clarified, thank you. That is immediate. The full process, however, is very prescribed and can take a while.
And that's important because, and look, we're going to have this all the time. There are people that aren't going to want to come back to work. And of course we want to protect everyone, but for those that are, we don't want to leave the statute so open that people can just say, I'm not coming back to work. You can't fire me and you have to pay me. And so we want to know what processes are in place that basically validate your the findings, the investigation, things of that nature, as well as the timeliness. I believe we have a little more of that. I don't really have any other questions. I'll say, Commissioner, Mr. Strack, I really love his energy. It's good to see people that are excited to do their job because it makes it a lot better for us, because we drain Laura like a bunch of leeches and she still comes to work smiling every day. So it's great to do that too. I really appreciate that. Does anyone else have any questions of these gentlemen?
Mr. Chair, I actually wanted to ask, if it's okay, a question.
Please, I was going to ask you that. Make sure you get them all out because we're dependent on you.
Okay. Oh, well, thank you. So in the testimony for House Bill 124, that was Delegate Valderrama's bill that related to COVID-specific safety standards. The Department of Health submitted a letter from the Department of Labor from Secretary Robinson to the congressional delegation about the issue generally of sort of why the governor didn't want to pursue an emergency temporary standard. And I mentioned, I'm not putting them on the spot. I let them know in advance that I was going to ask about this. The letter sort of goes through some of the, it seems like potentially lapses in the law and some, I guess, sort of reasons why local health departments have been stepping in during COVID to sort of fill enforcement gaps. And so I wanted to ask, while we had everyone on the call, for the members' benefit, are there any sort of parts of the law that could be tightened or expedited in these emergency situations to give MOSH more authority to investigate quicker or resolve things faster? It seemed like in the letter, it was pretty clear that the laws didn't really give you all the tools that you may need to respond to complaints.
The big problem with COVID, and if you kind of bifurcate COVID with other potential disasters that might happen, the problem with COVID is our law only allows us to regulate the employer-employee relationship. And with COVID, a lot of the issues were non-employees coming into businesses. We have no authority over non-employees. So the great thing about what the governor did was by looping in the health departments with executive action, you loop in the health departments, and the health departments were given the authority to go in and shut down a business immediately because a non-employee was doing something. But we can only control employees. The health department was given the authority to control non-employees. So that's kind of why what the governor did was working, and we didn't think an emergency temporary standard was necessary in Maryland.
Okay. I guess that's interesting. Laura, I think we need to rope the health department in through this to fill in those blanks. If there are any that you have, and I know you kind of put people on the spot. I love the question, but I know they.
No, I didn't put them on the spot. I let them know in advance that I.
No, I don't mean it that way. I mean, it's hard for people to answer those questions truthfully because they are the agency. Of course, it's running perfect.
Right.
But no, I'm joking because the question is appreciated because this is our opportunity to fix any of the shortcomings that you or your employees are seeing in dealing with COVID, because we can't predict what the next thing is. But if it's COVID part 2, we need to be ready. If it's COVID or the bird flu or whatever, we need to make sure we have smoothed and we have greased the skids as much as possible. And that's, so that things, any bumps in the roads that you guys found that we can hammer out now would be phenomenal.
So one thing I just wanted to point out, if it's okay,
Please.
It builds off of what Matt was saying about the non-employees. A lot of what we do in order to hold employers responsible is dependent on us being able to establish and develop and identify employer knowledge of the hazardous condition. So a big part of that is if there's any sort of ambiguity with where the source of an infection is, normally this is meant for chemical contaminants. So it's very hard to hold an employer responsible for asbestos exposure if they show us a survey that says there's absolutely no asbestos in the building. So we don't understand how we could be violating an asbestos law. With the pandemic being so community affected, it creates a really hole. And that's, to us, I know we're going to say everything's working perfectly, but to me as a safety and health professional, that's why I'm so proud to be in the state of Maryland, because it really was a multi-pronged attack that really cut in to a gap that we don't have with non-employees. By utilizing the health department, that really goes a long way and does that. And it kind of makes the point, it could really establish our point better if there's an outbreak and the employer says, well, it's not from our people, and the health department has it on record of, well, we looked around and the customers are wearing everything and all these other things. Now that's that much easier for us to narrow it in. So the beauty of a multi-pronged approach, and other states haven't been doing that. And you can see the results and the frustration when you talk to their safety and health officials.
And is the health department, do they have the same powers that you guys have as far as identifying and immediately addressing closing down a building? I mean, I guess I know they can close down a building, but or an establishment. Do they have? But as we're again on the workers' protection side, what this bill is all about. So basically, the health department would be they would be the people to close it down. You guys would be the people to lay out the conditions for safe reopening, ensuring that it's safe, things of that nature. Is that better? Is that kind of correct? I'm not trying to.
Yeah, I'm not. From our talk, Matt, if you want to go ahead.
First part, yes. The health department does have the authority to shut down a business immediately under the executive order that Governor Hogan wrote. MOSH does not have the authority under current law to shut down a job site or a building immediately. We issue fines and citations. We can tell people what to do, but we cannot shut down a site. That's not within our law.
Would it be difficult if it was in the eyes of a catastrophic public health emergency? Would it be difficult if that became a purview of what you could do? Is that something you guys would make your job harder or easier? In a public, like I said, in a catastrophic public health emergency, only under those standards, to be able to go in, identify, investigate, and shut down immediately.
The only problem that I see with that is you got to remember that the employer has the right to contest our stuff because we're so prescribed. That kind of bypasses, and in very rare instances, it has happened, but it takes a lot.
So does it always take the health department? So in a situation where we're talking about like a contaminant, a hazmat spill, who shuts that down and evacuates it?
That might be more of a public, the fire department or that's sort of what the MOSH and OSHA wouldn't have a role in that part. In real time.
I know they don't, but I'm trying again. We're trying to create in these specific circumstances, and we'll call it COVID-2, more advantageous to the public that you could do that only under those circumstances.
The thing that I would say is that in the times that I know of, that when federal OSHA did attempt to shut a site down, and it's one or two if I could think of any in the last 30 or 40 years, it goes to administrative law judge for them to they either approve it or reject it. It isn't necessarily something you can slap on the wall and that's the end of it. It has to be adjudicated because the employer has rights to be able to refute that.
Right. Now the health department can just do it immediately. Health violations.
Under this executive order, yes.
Yeah. And we're trying to, again, create something in statute that would outlast this executive order. Okay, guy. I appreciate this, guys. I don't know, Pam, I know you had a question. I didn't see it on the chat, but Joy said you put something up. Did I miss it?
I had it in the chat. I had to run to another meeting. So when you come back in again, I think you lose it from the chat.
Oh, what was it?
Now I gotta remember myself.
I got it. If you can't remember, I can repeat.
Okay, what was it?
I've got it.
You may have
your,
answered it.
your question is related to the reporting protocol internal to the agency. Before a complaint is escalated to MOSH, aren't the complaints anonymous? If so, how can failing to report to work occur?
Yeah, so that's what I was concerned about. My understanding is you aren't the first person should be hearing this complaint. That they should have had someone internal to their agency who escalates it to you, right? Is that not the case?
No.
No? Okay. So
I mean,
if I have a problem, I call Mosh right away. I don't go to my manager.
I mean, you can.
Oh, yeah.
Yeah,
Ideally, a strong safety and health culture in an organization, you would
Right.
report that to your supervisor. Absolutely.
Right. So to me, going to you is an escalation, not that because somebody didn't handle it internally. But am I wrong? Is that not that's not the protocol? I mean,
No, I mean, that does occur, and that situation has happened numerous times. I can attest to that.
And with regards to public safety emergency, and I know yours goes to anonymity, and I think that's just going to be one of those. I don't know how you can be anonymous and then ask for a day off.
that's where my other part was at, because
Yeah,
I can't if you're anonymous, how are you gonna tell?
right.
So I don't know how we work that part out.
Yeah, that's something I think we'll do
Right
it
to
as a
complain
committee.
anonymously. Employees and their
Uh-huh.
representative can complain anonymously. They have to disclose their names to us, but Mosh does not disclose their name to the employer.
Right.
Of course, right. But the employees got to know this person didn't show up, and
Right. So we'll deal with that. I don't know if they get to be anonymous and not show up. Somebody's going to notice they're missing. Chris?
Yeah, real quick, and Commissioner, when you brought up the the example of how your department is working in a way that's unique through these executive orders with different departments, like the Department of Health, I asked the governor's office, yesterday, how many changes there were to the executive order since the first one was created. The answer is there were 40 changes to the executive order, and that's why I sort of, and I guess I'd ask you whether you'd agree with this, but those changes mean that we were adjusting, tightening restrictions, loosening restrictions as the pandemic was kind of ebbing and flowing. And the governor could do that because we gave the governor broad authority to be flexible in laying this out. And I find, and I'll just ask you the question, I think we would find trying to put this in statute is by nature going to be difficult because, we're taking what needed to be a very flexible process, and we're trying to draw, clear rails of compliance for businesses and enforcement that keeps the businesses within the rails. And perhaps, these executive.
My boss, and I think he's fantastic, but every governor hopefully is going to act responsibly with the authority that they have and not abuse it or overuse it. The beauty of what has worked is the flexibility. And if you even look at the CDC guidelines, they change constantly. They changed again today with what kids in school can be 3 feet apart instead of 6 feet apart. The flexibility is what you need. Lockings, if any kind of law that changes that is too prescriptive ties the hands of the executives. Broad is fine, too prescriptive, and then you lose the flexibility to change and adapt to conditions on the ground.
And Mr. Commissioner, I'm sure that as we work on this bill, I would definitely get your number and we'll talk to make sure that I don't want to. We're not trying. We have a great council, but we're not trying to step on your toes. We're not trying to, like I said, do things that are gonna, cross what you guys are already doing. And so we'll be in contact again. I don't want to hold you guys. I know it's Friday. You guys can go home and see your families. Andrew, congratulations, because I've seen you before several times. So is this like another new job? I swear I've seen you a bunch of times.
Yes, I've been with the department for a little over a year. I think if you recall, I did work with your good friend, Delegate Fisher.
There you go. I knew I recognized you from somewhere, brother. So congratulations on your job. Gentlemen, I won't hold you guys. We got a few other subcommittee things to deal with. Does anybody else have any questions? Outstanding. Well, I'm not going to boot you guys off, but it's going to get real boring real quick. So
No problem. We appreciate your time, and we'll get you the statute for the whistleblower laws.
thank you
Thank
very,
you.
very much.
Thank you.
Thank you.
Nice talking to you.
All right, Laura, that was actually, thank you guys. That was actually a very good idea. It really brought a lot into focus for us. Some things off our plate, I think. Madam Vice Chair would
Oh,
agree.
you're welcome, CT.
I was going to say thank you. If you just be
That was my
patient.
idea. Thank
I
you.
know it
You're
was your
welcome.
idea that you're
I'm just
pushing
kidding,
about.
man. I'm just kidding.
But I do think we need to reach out and find out, number one, what JCO means and where they fit in as far as the hospitals, because I do want to satisfy that issue that we have with how we can protect those workers as well. Okay, I think that's our next turn on that. I want to step away from this bill for a minute unless people have questions. I know we have other bills, Laura. Do we have the electrician's bill?
The electrician's bill has been assigned to subcommittee. I can sort of give the high points if you want. I've, in testimony, a number of amendments were referenced, but we have yet to receive a member-sponsored amendment.
Isn't
The Senate is actually, Senate EHE voted out a bill with some solar amendment, but not amendments addressing the low voltage issue, which was most of the testimony in the hearing. So
Well-
I can, if you want, I can give sort of the high points, and then maybe we could have a subsequent meeting.
Well, we've dealt with this bill for several years. I don't know. Does it differ? Because what I don't want to do is, and I know that, the Senate sponsor, the House sponsor has been busting his tail to work on this bill, and we keep say come back next year, do some more work. So, but is the Senate bill, is it much different than what he's worked on?
It's a cross file of
I
his
know,
bill.
but what's come out of EHE, is it drastically different than the bill he's filed here?
No,
Okay, well, that's good. I just, because, I know he's done a lot of work. I reviewed the bill the other day. If you want to briefly go over it, I'm not trying to drag everybody, guys. We'll be done in a few minutes. And I also wanted to say, before we jump into that, there were 3 other bills that we had. We don't have to vote on them. They'll probably go in the drawer, but they were having to do with the Maryland Family Healthy Workers Act. We're not going to tackle that. We're carrying this big monster. So I don't.
Well, Mr. Chair, Vice Chair was supposed to.
Yeah, the amendment's in review. I'm waiting for, I don't have it yet.
But that's to
Oh,
Derek's bill, right?
That's 2581, correct?
No, yours was for 1326, wasn't
It
it?
is. It is from 1326, but it is an amendment that will be to 581
Which is the
Oh.
chairman's bill.
to pass 1326. But we can talk about 1326, what's in the amendment. Like I said, I worked with the other, got this amendment. There will be pieces everybody on this committee will like. There'll be things they don't, but it'll be a document for us to review. But it's in review in DLS. As soon as I get it, I'll share it.
And again, because this bill does not have to be out before crossover,
Correct.
yeah, we're doing just fine on time. I believe we're doing just fine on time. And
Mr. Chairman,
yes, sir.
there's a bill of mine that is related to Healthy Working Families Act, and my understanding is the Senate's waiting, like they would move the bill, but they're waiting on Economic Matters to do the same. And I would just make a polite appeal while we're together here to, consider moving that bill.
And again, because when we do that, there are those other bills we're going to start having to move too. That's going to work in opposite to the bill you're trying to push. So I discussed with the chairman about not moving any of those modifications of the Healthy Family Workers Act bills this year because of what we're trying to accomplish. And I was trying to keep that across the board because again, I'm not moving any of them. Vice Chair's got a bill. Hers isn't moving. And as a colleague, Chris, of course, will listen, but I'm trying to not move. And many of those bills work in opposite of what you're trying to do. And so I'm not trying to make it any better. I'm not trying to make it any worse. However you want to take that. I'm trying to work on what we're doing with the COVID. If that's our.
And the amendment from 1326 will be health emergency.
Right. And
If not
focus is
anything else that's in it.
We're working on focusing this year on the health emergency, not the totality of the bill. That's the preference. I hope you understand, because again, if I touch one, I got to touch them all, and we start going through, and we might undo some agreements we've already done and worked out. And I'd rather, just work on what we have, Chris.
You're the chairman. Thank you.
Thank you for throwing that in my face.
And by the way, I know what JACO stands for.
What does it stand for?
It's, Marta Harding just sent it to me, but it's Joint Commission on Accreditation of Healthcare Organizations.
There we go. Well,
That's what JACO is.
Say that again.
It's the Joint Commission
Commission
on Accreditation
on Accreditation, okay,
of Healthcare Organizations.
Health Care Organization, okay.
And it's the body that accredits hospitals across the country.
Okay, so on JACO, Mr. Chair, okay, we're going to really look into what they do, okay, to some of these things that we have a problem with, like do they don't handle time to, time to file a complaint? Do they handle that?
Well,
Do they have the right to refuse work? Do
Yeah.
they?
That's what we're gonna ask.
That's what we're dealing with. Yes, ma'am.
That's under JACO, all of us.
Yes.
Okay, and hazardous pay?
Again, that will kill this bill. They don't handle that. That's what we handle. That will destroy the bill. That'll be a hard bill for me to vote for. Very clearly, when you put those financial constraints on this bill, it moves nowhere. So
The only way to do it is if there is, and we can't predict what happens in the next.
right.
If there's federal funds available for hazard pay,
Yeah.
or the state
federal funds.
kicks it in, that would be fine, but we
Right,
don't
because-
know what that's going to be.
And when I asked the chair, he was very specific. We can't constrain the state by telling what they're going to spend. Now he's looking into what monies we have received, and maybe we can deal with those. But if but it will not be prescriptive. We will not be, forward looking, because we don't know what monies we're going to get. Depending on who won this election, we might not have gotten any money for this one. So, and I'm talking about the presidential, of course. So it just so happened that we're getting money. It didn't look that way for a while. So that's not a pit I'm willing to jump into. We can discuss it, but definitely I know that that's a poison pill I couldn't even vote for.
Yeah. Well, I think it still deserves a discussion, okay?
Yeah.
Because we can't let the hospital association come in and tell us what they going to do and what they not going to do. They can come in here and say, I want that stripped out of this bill.
And I want you to know, Delegate Turner, I don't know if I told you, I talked to Delegate Dumais today, or Vice Chair Dumais today. I'm not letting that happen. I can't go to sleep at night knowing all these doctors and nurses that died taking care of us. And I know the hospital's down. That's a tension I'm not going to live in, which is why prior to JACO, there was another organization, Jeremy talked.
Yeah, there are several there's some state organizations that.
And the Vice Chair is going to be doing me a great favor by going to reach out to the Vice Chair of
HGO, right.
To find out just what other organizations who already do this, who already manage and mandate how these hospitals are run, and make sure that they stay open and make sure their workers are protected. And writing in this law, we can refer to them and make sure they do their job.
I just want you to have me in my mind so I can justify this to a couple of other groups. Okay, the rationale. I go and I try to listen, we can't do this because of blah, blah, blah. I don't want to, them to think that we didn't try.
Well, promise
but
you.
Rationale about why we can't do it at this time.
The fiscal note in itself is stunning. Just the
fiscal note. Okay.
That's one. Two, having no guarantee of funds coming from the feds, which is what they but we don't really, it's like Derek said, that was even above his pay grade on how that is going to be disseminated.
I heard it.
So we have no way of pulling that, and I'm not going to put that into a bill, because believe me, my original argument was, if they want, like Madam Vice Chair said, as long as the state is willing to make sure that those businesses that gave it are compensated, I'm down with it. Follow your treasury, you'll find your heart. And I was told, without a doubt, that is not going to happen. Don't do that. There is no money for that. So again, we have to work within the pragmatism that we have as a group, when it comes to that fiscal dollar. So again, because I know that it's not enough. We have to make sure we have a discussion. You have to give it your rah-rah, and we have to explain to you, I'm not dismissing it. We have valid reasons why we're not gonna address that. And I'm not
Okay,
gonna put that in the bill, okay? I'm not
yeah,
gonna promise.
I got it.
So, but we will, and again, we are not going to just dismiss the healthcare workers when it comes to right to refuse. As you've already heard, most made it very clear, if we wrote that in the bill, that would be an opposite to their current legislation. So
Yeah, I heard it. I heard
we'll
it.
take care of that, okay?
Mhm. Okay.
Beyond the electricity bill, do we have any other bills? Waiting for Laura.
I'm on mute, sorry. We have those House Bill 350, House Bill 909, and House Bill 1326. Those are the 3 sick leave bills that you
Okay,
said you were.
again, those, as I made it clear, I'll put those in my drawer for now. So we just have the electricity bill.
Are we supposed to be doing the vaccination bill?
We'll have to follow up with the chair offline about that.
I'm just asking.
He said he was sending it to business regs.
He did
sure
say
did.
that.
I thought
He
he was
sure
joking.
did.
I got a flood of emails on
Delegate
that.
Howard, just don't. I said, no, 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 no.
You know, there was another bill out there that,
Yeah,
yeah,
1045.
yeah,
Delegate
I
Bible.
said from the rooftops, but nobody,
Well,
It's funny. Are you muted? I'm not sure I caught that.
what was that again?
I said it from the rooftops. Move that bill. Move that bill.
We'll still
Trying
have an
to save you.
opportunity. I'll speak with the chair because, you know, in reviewing that bill, it's, we'll deal with that. I'm trying to think if there's anything else.
Yeah, that was the only one I remembered, right?
Okay, so
What's the electricity, Laura?
we're
bill?
getting
House
ready
Bill
to do that right now.
1262.
1262. Okay, got it.
Mr. Chair, I also have a question. I remember
ma'am.
we had a couple of bills related to the digital connectivity or 5G. I think one of which was to establish an Office of Digital.
Yeah, that one is coming over from the Senate, and we may take it's Lerman's bill, and we may, or Delegate Lerman's bill, we may be taking it up. We've been waiting for the Senate amendments because they've been kind of working on it over there. It just passed second reader, and I assume last night, and I assume third reader today.
Okay, so I think that this is a really
that's
important
Bob's bill,
time
and he's aware.
to make sure we have that kind of attention and activity for all the kids who need to learn.
Yeah.
Well, I'll tell you this though, and again, that's going to be I know Delegate Lehrman's bill. There's a lot of skepticism depending on where you live about bills like that, because where I'm from, not a popular one, because we fought so hard for, you know, for that kind of broadband, for attention to our rural broadband.
Mhm.
We've already, you know, and again, you're telling people from Southern Maryland, Baltimore's not going to take all the money this time. Nobody's believing them. So that's not as clean of a bill as we think. And I don't think that's one that's going to have to come to subcommittee, because
Not BR.
the subcommittee to either punish me or did he need that one's just one that's going to have to be done on committee.
Yeah, I know. I think that's right, but we haven't taken it up, but it's on the radar.
Yeah. So, and thank you, Delegate Chief, for the reminders, because we got to deal with all those. Okay, Laura, knock us out with the electricity bill real quick.
So the general premise for this is House Bill 1262 is not new to you all. This is a perennial issue for my 10 years with the committee. The main issue with electricians and the way they're regulated is that there is not a state license for all the different classifications. There's a state master license, and then it's mostly done on the local level. So some electricians have to get licenses in many jurisdictions in order to be able to work in all those different jurisdictions.
Mhm.
So there has been a push over the years to sort of standardize the way that they are regulated so that it's easier for them to have portability from jurisdiction to jurisdiction. So it's controversial because there are a lot of sub-industries within the electrical industry, like the low voltage people, solar installers. There's a lot of different people, and the bill sort of completely reforms the way that they're regulated. So what this bill does is it repeals local authority to license master, journey person, and apprentice electricians beginning July 1st of this year. And instead, a local jurisdiction may register. So the main credential would be a state credential, but this was over the years, this has been sort of the biggest sticking point with MACO, is the counties, this can be an income stream for them, and it's always been a local enforcement scheme. So there was real pushback to sort of just repealing their authority to regulate electricians at all. So the compromise was that they could issue registrations and still do permitting, but the main credential, the license, would be a state license. The bill also sets up a state journey person and state apprentice license. We have not had a state credential for that. So some sort of people who've come in on over the years have said that in a way it can be a barrier to wanting to advance in the profession, because some jurisdictions have local journey and apprentice credentials, but others do not. So you just have to try to work your way up to the master in order to work in that jurisdiction. The bill also establishes a continuing education requirement. It sets up a state electrical code that would sort of govern. The way it works now, it's a patchwork. Depending on which county you're in, you might have to be familiar with a different code. So this sets the National Electrical Code as the state standard. The bill also has a provision that requires at least one licensed master or journey person to be present at each job site where electrical services are provided. That's, I believe, a pretty substantial change. And so that's something that's been discussed a lot over the years. And just otherwise, there was a work group that met. You all passed legislation last year that set up this work group. The work group met and they made recommendations on a number of points, but the main area in which they couldn't agree was how to handle the low voltage sort of sub-industry. So at the hearing, there was a lot of testimony asking for different amendments to define low voltage, to make it explicitly clear that they're not sort of brought in under this new licensing scheme, because some counties license or regulate low voltage workers and others don't. It seems still there's not quite agreement as to how to treat them, whether to define that, whether to set up a work group to further study that. And it sounds like the Senate added an amendment about solar installations. I haven't seen or received any testimony about that, but those are sort of the outstanding issues that I think are on the table, are like how to treat low voltage and what to do, if anything, about solar installers.
Mr. Chairman.
Yes.
This bill we've heard in years past, and my local control tendencies. I'm remembering MACO and all these other organizations really not wanting this bill, and I didn't dig into this the way I've done in years past, because I think we've debated and tried to work this bill in years past. But I mean, this one's Laura accurately described it as very complicated, but part of the reason why it's complicated is because local jurisdictions like their own, the fee, right, but also the responsibility and control that comes with it. And I mean, there are time and places to consolidate and deregulate, but I've never been a super fan of this legislation. Just a point of observation, and maybe this year is different for the committee. I don't know, but I'm willing to listen. And if we're going to move the bill, it surely needs some amendments that some may have been offered to the committee already, or some that are waiting. But just thought. I mean,
Laura, it's in the Senate now. They said, is it the Senate? Did they say they're moving it, or are they waiting for us to move it?
No, EHE voted it out with the solar installer, some sort of amendment about solar installers, and I don't know if it passed second reader yet, but it's been reported to the floor over there.
And it sounds like one of those ones that we're gonna play off what the Senate does, and I'll talk to the chairman. I don't know how he feels either way about it. And I'm not always a big fan of just doing what the Senate says, but I also know that we've been, guys, I don't know how much at some point, right there, I'll be there in a minute, Pam.
Okay.
I just don't know what we can do. Go ahead, Pam.
Well, no, what I was going to say was that my understanding, and I think I understand why the Senate moved it, is because of, this has been banded around for a while, but because of some of the agreements, not all, other agreements they came through with the work group. I don't think they got, agreement on the low voltage part, but I think there has been progress. And, I think people are recognizing there has been work done, and this probably is not going away, and let's try to, get to something that's workable. So that's why you saw it moving in the Senate. And I think we should, I think we should follow suit as well, because there has been work put into this, and I think there's some merit to addressing some of the.
Yeah, and I guess it's a low voltage issue that's still, I don't know what the Senate bill looks like. Laura, do we know if
And
they,
you may take that piece out, yeah.
well, have they even dealt with the low voltage issue in the Senate, Pam? Do you know?
They didn't.
Oh, God.
They did
damn
not.
it.
They
Mr.
did
Chairman.
not. So
Yes,
they're
sir.
not.
Pam, I think makes a good point. We've brought it every year. This is certainly an issue. And I would say this. There is an amendment out there that relates to the low voltage,
I saw it.
and it's supported by
Everybody,
and important people to me, and also to the committee, surely to the chairman. If we're going to,
including Hornberger.
if we move the bill, if we can include that amendment, and if
I
that's,
believe that's the only way we do it, guys. I know crossover is coming. We have to be here tomorrow, don't we?
Well, we haven't received any amendments from sponsored by members. So that's another thing. If you all want to sponsor any of the low voltage or solar,
Chris,
any
do you want to do
amendments.
that? Do you want to find out what the amendment is and sponsor it so we can get this pile of dung moving? Because right now, I don't want to be stymied on that. Chris?
Well, I mean, I can also follow up with the sponsor and just say where is he on that? Is he sort of, it seems like there's still some disagreement about how to treat. So I don't know if he's made a decision what he wants.
well, Mr. Chairman, I have the amendment. I can,
Of course you do.
I can offer it to the, in helping the chairman move the bill. amendment,
Yeah, if
and I'll
you
make
wanna,
sure that you have it.
if you can just give it to Laura, I'm sure she'll send it to me. We'll address this, guys. Makes it better. Seth hasn't said anything all day, so hopefully if we can get this bill moving, I think that'd be great. I'm not sure how the bill looks compared to the Senate bill. We've voted this out before, haven't we?
I don't
Last year
think
it
so.
was in
Oh, did we?
2013. In 2013, this committee passed a bill
Exactly.
that said a state license. There was no local piece of it. It was very bold, and it died in the Senate. But last year, you all passed a work group. So this is the first step in many years that you would be taking on this.
Yeah, okay.
And I believe this is the bill that after some compromises, Montgomery County was supportive of. I think it was either 2019 or 2020. Montgomery County wrote a letter or whatever,
Yeah, I think it's about this bad boy moving. So Chris, if you could do me that favor, get it to Laura. We'll figure it out. I'm sure we'll be meeting tomorrow, guys. And if not, we'll bully this through. I'd like to get it out of subcommittee tomorrow so we could get it on Monday, one of the calendars, and then start firing it out. Again, crossover isn't always death for the bill, but if we can get it out before crossover, that would be great. Laura, do we have time?
Yeah, I mean, I don't have capacity to draft the amendments. That's why I've been kind of saying, like, somebody has to get a delegate to request an amendment. What I mean,
we just assign someone to do this, like Seth or.
We did. We said Chris.
Okay, I elect Lily Chi to do it then. Put at large.
Low
Here you go.
voltage. That's not sexy enough. I don't do low.
So Chris is going to do it. We'll get it tomorrow. We'll vote this out of subcommittee tomorrow. We'll get this bad boy in the committee. This should be a stumbling block. Again, I don't have anything else coming down the pipe. Yeah, I'll talk to the chair about that damn vaccination bill. Maybe I'm just the only one that said no, but I don't care that heavily. Whatever gets the bill moving, maybe we'll just do that on the floor. I don't think that there's anything for us to work on. And I talked to the sponsor of the bill today, and I was like, well, there really isn't anything to work on. It's either an up or down, so it shouldn't be in our subcommittee. Any other questions, guys? I think
No.
Vice Chair looks really angry. So
Delegate Wilson, what are I'm sure there's a lot of people that are interested in this question, but I'm most interested. What is the next step for the essential worker bill?
the next step for the essential worker bill.
What do you need from me?
Oh, a lot. I need you
Got
to,
matches if you.
yeah, I need you to, talk to Madam Vice Chair, get with Jacob. We need to solve the problem with the hospitals. The way the
Okay.
hospitals are, so we don't have to cut anybody out. I think we also need to make sure that we deal with Motion OSHA as far as how the complaint process, the retaliation process, make sure we're lining up with them. We really need to bring in the health department.
Refusal to,
Yeah, that's part of it, right?
yeah.
And we really need to bring in the health department. It sounds like for the immediacy of what we're dealing with, we're going to need the health department. I don't know how to do that. I know that's a bigger pill, but because it sounds like when there is an emergency, most can't close it down, but the health department can. So
Well, my
Really?
understanding of what, just in reading through that letter that I was referencing and hearing the commissioner, Governor Hogan issued an executive order that gave local health departments the more authority during the COVID state of emergency to shut a business down or sort of take immediate action. And so it's not,
Isn't that something
I
you have
don't,
to do?
well, it's not that's, I don't think that's a sort of permanent structural authority that the State Department of Health has. I think in this case, the executive gave authority to local health departments to step in.
Right, and I don't know, and this is like almost why we even have the bill, so Chris, but it's like, if we're gonna do it, do we provide a path for the next pandemic to say, okay, well, if this is the case, and make sure the health department steps in to give the local health departments the immediate ability to go out and address these situations, close them down, evacuate if they have to, or do we because honestly, by that theory, we could step back and let the governor do everything. And that's why I got a feeling that we're not doing that. Otherwise, we wouldn't need to be here.
Well,
Yes, Chris?
I guess the thing would be, are we here to give guidance to the businesses? The regulatory agencies are already there that can enforce and penalize, but what worked best for me as a business owner was not trying to stay in compliance with, hard laws. It was, we were getting a lot of information as to how to operate our business, how to be safe in front of customers. And we're a retailer, so we actually closed our retail store to anything but special appointments. You had to call for an appointment to come into our business, and we did that because that was some of the guidance we were getting, and that was helpful. I think if you put too much regulation on businesses,
this wouldn't be anything to do with the businesses, brother. This would only be empowering at best the health department to do what they've been doing, just like we're going to empower Motion OSHA to do what they've been doing. It's just, here's the thing, Chris, remember where the bill started from. We gotta put something out. We gotta do something. We've cut out this bill. We want to make sure the individuals know that we want them to be safe, and assume there's going to be a lazy Democrat who's the next governor. Maybe that'll make you feel better. So if you assume that, then what would you want that lazy Democrat, good for nothing governor, what would you want to make sure he did or she did?
Gave proper direction statewide to a state agency to disseminate and target, identify PPE, and not leave it up to 24 jurisdictions.
And that's what we're doing. That's what we're going to do now. That's exactly what we're trying to do in this bill. Okay, because we don't want that. You hit it right on the nose. We don't want 24 jurisdictions because it's untenable. It's the same thing as every jurisdiction handle their own vaccination protocol. It doesn't seem to work very well. I get it. That's why we're trying to do something statewide instead of kicking it to the local jurisdictions. I'm with you 1,000%, Seth. That's the nature of this bill. Okay, it's a great.
Fine. That's just not. That wasn't the vibe I was getting. It was to me. I mean, I'm just, it was kind of like, I don't know. We'll let the health department look at it, and then they can send it off to the local. At least that's what I was picking up.
But the health department is the state entity that can decide how. We want the health department to have the flexibility to empower their local jurisdictions. We still want them to be held accountable for all of it, right? So when we say it, we don't say kick it away. We say you have to set up protocol for the local jurisdictions to follow.
So, Mr. Chair, if I could clarify what you're trying to say is you're saying by doing it statewide, we're essentially setting a floor.
Not a ceiling, correct. But we
Yeah.
need a definite floor, so we don't have 24 people doing, I mean, they're gonna have differences because we're different areas, but they shouldn't just be so diverse that we don't have the same outcome for the different parts of the state. Okay, that's my goal at least. I got to feel
This is like a minimum wage kind of thing. You set a floor.
Don't say that, Lily. You got Republicans on here. They hate hearing minimum wage.
We do?
No, no, the Republicans do. But no, that's where we're going, Seth, okay? If you think there's something in the bill that's too loose, let me know. But remember, I got Chris saying, don't tell me to do nothing. Find that, that narrow area between the two of you guys where we do a statewide guidance. We'll just pretend it's going to be, God forbid, but the next disease is going to be H1N1 or 2 or something relatable to what we're dealing with now, the pandemic. We want to have everything in stone. We want to have everything ready. We want to have all the guidance for the state so the locals know what to expect and the state knows what to expect. That's where we are. So, Laura, I talked a lot like I was getting ready to run for election.
We're used to it. We're used to it.
Yeah, so I'm going to follow up with the vice chair who's going to reach out to Delegate Pena-Melnick and maybe HGO for other information about hospital regulation and right to refuse. And then I'm going to follow up with the Department of Labor about the existing timelines for making a complaint, the retaliation protections, right to refuse.
And the exemption right. And we want to make sure Seth said that we're able to apply this to the supermarkets and the hospitals. And also responses and what we expect of them as far as responding to. And again, I don't know who the who is because most said they can't close anything down, but who does the cleanup and how does anyway.
I never said, what are you talking about?
You were talking about, when I was talking about hospitals, you said, well, if we're going to talk about these, specific essential workers, we need to also talk about grocery stores.
Oh, yesterday. You're talking about from yesterday. Okay.
Yeah, I mean, come on now.
Because I was talking about it in relative as far as food chain and distribution.
And applicability.
As an example.
I understand. I got it. All right. All right, guys. I thank you guys for your time. Apparently, Mark Fisher does not want to be a part of our group anymore. Thank you nonetheless. Does anybody have any questions?
When are we meeting again?
April 13th. April 13th. We'll set the agenda now.
That would work for me.
I was thinking Chris is not getting enough of this group.
Mr. Chairman, all I can tell you is I've been sitting in a chair, whether it's this chair or the one downstairs, for like 8 hours today.
Right. It was a whole, guys, I asked Laura, I text her, I did not want to have this meeting, but she had invited these guys. Thank you, Chris. Otherwise, we'd all be home by now. So
can I just say this? Can I just say this? We didn't want to have this meeting either.
Believe me, I texted them like, we're not going to do this.
The meeting was very informative. It was very
All you got to do is call for a motion. I'll give you a
was.
motion on that bill.
Well, I'm glad we met,
No, it was a great, it'll be really working out. So we'll probably have to meet tomorrow on the electrician's bill, okay?
Yeah, if we have the amendments. I don't know.
Yes, please, somebody
We have
offer an
amendments.
amendment.
Chris is going to do it. I have faith in him. And then
Or do you want me to send that to you, or do you want me to send it to the amendment office and let them draw it?
If you could send it directly to the amendment office, I have amendments that we got in the testimony and from some of the stakeholders, but in order for the committee to adopt amendments, we need them to be proper.
I'll do that, and I think there's a couple different groups that are asking for the same thing. I'll make sure that it's including everybody's interests, and we'll get that to the amendment office today.
Okay, thank you.
And
Thank
Chris, oh, I'm sorry, Chris, can you remind us if MACO is in agreement in support of this bill?
Well, let me just say, this is a bill that I've opposed in the past, just simply on the local control part. MACO is opposed to this bill. No amendment's going to change that.
Ever.
If the chairman and if Derek wants to move the bill, then that's where I'm getting the sense that you may want to move something. I better be part of the conversation than just to put my foot down and say I don't like it. So I think this amendment is one piece of that conversation.
And that's why we appreciate you, Chris.
I think that actually MACO is in support of the bill this year.
Oh, they are? Really?
Yeah, that's what I thought, because all the counties are in support of,
NICO supports the bill this year.
yes.
Well,
Okay,
it a work-
then
was
Chris
this in a work
completely
group?
retracts his earlier statement.
Yeah.
Right.
And Chris, you're just gonna be the odd man out. We'll deal with this tomorrow. It won't take long.
You realize, CT, that I killed one of Howard's bills yesterday.
Yeah. Oh, trust me. No. You and Dumais, who moved. Oh yeah. You're in my sights now, Dumais.
So guys,
Favorable. We were talking about an amendment.
I mean, it's hard enough for us Republicans when you don't need Republican on Republicans.
right.
I love you guys. I do.
I love you too, Seth.
Yeah, we're all getting a little punch drunk now, guys. Thank you guys very much.
See you guys.
We will catch up tomorrow. Take care,
All
guys.
right.
Yeah,
Bye.
okay.
Bye.
I'm gonna be ready. Okay.